Hello again and welcome to Newborn and Beyond. My name is Leslie Ann and I'm your resident health visitor and I work here in the UK. Today we're going to talk about cradle cap, which is the skin on the top of the baby's head, or might be the eyebrows, on the forehead, going to the probably halfway down the back of the baby's head, where the skin looks like if it's lifting and it becomes quite scabby. It looks like dermatitis almost. So cradle cap is the actual cause of it is unknown. We just know that it causes the baby irritation sometimes because the older babies can actually put their hands and itch at the area and can cause, areas to be pulled off. It is not to be peeled because it's actually attached to the baby's skin. So this will cause the baby's skin to bleed. So there are different ways to treat it. I would advise my parents to not use the shampoos or anything because it can be quite strong for the baby's skin. There are simple methods that you can use, and one of the methods that I advise is to use Vaseline to cake over the child's head overnight, and then it lifts up so that you can just comb it over the following day. Now, again, if you just take the comb and try to pull it without treating it first, i.e. putting the Vaseline on first, it will peel the skin. You need to make sure that you've covered the whole entire area of the head or face that is covered with cradle cap, and then leave it overnight and lift up during the daytime. Do not put anything like the shampoos or anything, because they can be quite harsh and they can be irritating to the child's skin, and obviously easily it can go into the baby's eyes and stuff. Like, you don't want to do that. So it is not contagious, it does not spread, it only irritates the baby. As the child gets older, you can see them itching, and if they do itch, they will bleed. So you need to be careful. So wash off with warm water. Do not with cool boiled water if you're thinking the area is irritated. Cool boiled water over the area and just put some Vaseline on it to moisturize, and that would be the treatment. If it becomes infected, i.e. if the baby pulls at it or it itches it and it looks like it's bleeding and it doesn't look too well, then I would advise you to go and see your GP for treatment. Yeah, so no pulling at it, no trying to comb it when it's dry. Vaseline over the area, leave it overnight and then lift off, and that should help. Okay, thank you, see you next time.